Hello, my name is Steve Long, and I am the President and CEO at Hancock Health here in Greenfield, Indiana. This is my first opportunity to do a Facebook Live post, so I think this is kind of fun. And I will tell you that if you have questions about some of the things that I talk about, we just ask that you put those in the comment section so that we can respond later as we figure out the technology, or at least as they train me how to do this. So there's three things that I'd like to talk to you about today. One of those is, what is Hancock Health doing this week in the fight against COVID-19? The second one is going to be, how is our county coming together, especially our county leaders, so that we can all be on the same page as we move forward in this battle? And then how does that align with other counties and the state, and in fact the country as a whole? So the first thing I'd like to talk to you about is, what are we doing here at Hancock Health? And hopefully you've had the opportunity to watch some of the videos that we have posted and read some of the articles that we have written, especially the open letter to the community. So I think that maybe you have a bit of a background. But the fact is that we have fundamentally changed the way that we do things here at Hancock Health, and that is in our hospital, in our physician practices, in all of our outpatient environments as well. And that is because we understand that there is a very strong potential for an influx of inpatients that are affected by COVID-19. And we know that the majority of those folks are going to need to be either on a ventilator, and that's the smaller number, and a larger number on oxygen. And the fact is that we just don't know how many people that could be. It is quite possible that the healthcare system could be overwhelmed if all of the people get sick at one time. So because of that, we have changed our operations. We've done a number of things. So for example, you know that we've closed our wellness centers. They've been closed now for almost a week. We have also begun to limit some of the things that we do on the outpatient basis. So elective surgeries. We still do elective surgeries, so you know, but it is focused on those that would have some harm to their health or their outcome if it wasn't done in the next 30 days. So those are the folks that we're still taking care of. Limiting some of our outpatient procedures as well in imaging. So we're doing all kinds of things to create capacity within the healthcare system to care for this potential influx of inpatients. Part of what we're doing too is I would like to characterize as when you're on the airplane and you're told that in the event of emergency and that mask falls down out of the ceiling, that you put it on yourself first and then you put it on the person next to you. The idea being that if you're passed out, you can't help the person next to you. So we've really been putting on our mask. One of the things that we have done is we have limited visitation and actually outside people into the building. We still have visitors that can come in, but it's one per patient. We're also screening folks as they come in the door to see if they have symptoms of the disease. And just so you know, if you do have symptoms, just please don't come to the hospital, because this is the last place that we want to spread that disease. We're very much about trying to take care of folks and controlling it. So we've done all of that. In addition to that, then we have set up new systems that we never had before. So we have our new Triage Clinic that's located here in Greenfield. And it is specifically for folks that have the respiratory symptoms and the fever and other things that we look for, so that we can work with them and help them identify whether they may have the disease or if they just have the flu, because you know we're still in the flu season, so it's kind of hard to tell sometimes. We've also created the triage line so that you can call our phone number, or that you can email a nurse and you can get information back in nearly real time. In fact, that triage line is now 24/7, so that you can understand some of the things that you should know. Now, obviously, we're going to be pushing you out to our website often so that you can get information there. There may be questions that our nurses ask that will help them identify whether you need to see your primary care physician or go to the triage clinic, but just use that as a resource. This is a huge thing for us. So we want to let you know that we are prepared, and we're now beginning to think ahead. So the idea is that if this were really to become a bad deal in Hancock County, and please note, it's not yet. We are quite certain that there are people that have the disease in our county, but we have not yet been overrun in the hospital. So we want to think ahead, 2 or 3 steps ahead, and see what do we need to do to make sure that we're ready for that. So please know, we continue to make all of those changes to our organization. So we are just one piece of this puzzle though, right? And we can do a great job at treating people when they've already had the disease. But if you've ever heard me talk before, you realize that I understand, and we have focused our organization on prevention, because it is a whole lot easier to prevent someone from getting the disease than it is to treat them after they've gotten it. So we're working together with the leaders in our community, in our county, in the city of Greenfield, actually in the state as well, to put in place some of the activities that would be required to help us practice social distancing. I'm sure that you've seen a lot of this on the news lately, social distancing. I actually heard a different phrase just yesterday, and that is that it's physical distancing, because social distancing means we're not talking to anybody. That's not true. We have all kinds of ways. This is a way that we maintain a social connection while being physically distant. So really what we're talking about is physical distancing. And that just means, how do we encourage ourselves not to go into places that have crowds? So the governor, as you know, has closed the bars and restaurants and the nightclubs. Our county has put a travel advisory into place, kind of like when we would have during a blizzard, so you just want to stay at home unless you really need to come out. The city of Greenfield has declared an emergency. So all of these things work together to help us make the decision to not congregate. And this is huge. And the thing that we want you to know is that since this is a disease that we don't have a vaccine for, we don't have good antivirals for, so there's not good treatment options, we really need to try to prevent it, and the only way we can do that is the old-fashioned way, and that is just stay away from each other. So that's what we're doing as a community. Our leaders are working together. You know that the governor also extended the closure of schools until the 1st of May and made it clear that that may actually extend to the end of the school year. That's all a part of this. I anticipate that the schools will do that, the churches will follow, and that our restaurants and our bars and nightclubs may remain closed for a while. And that is because this is probably, an 8 to 12 week thing that we're looking at here. So a couple of weeks to really figure out how bad it's going to be, and another 6 to 8 weeks after that to keep up the work that we're doing. So please know, we're all working together for the same goal, but at the end of the day, it's an individual decision and our individual behavior that's going to make a difference. So that's how we're all working together. Finally, I would like to reiterate some of the things that Governor Holcomb has said, and that is for the state as a whole. Again, he's mentioned that the schools are closed until the 1st of May. They've also mentioned that it's very important that you really touch base with your healthcare system if you're feeling the symptoms or if you're just concerned. Don't just show up at the emergency room. Don't just show up at your physician office. Make sure that you call, get the advice, be triaged, and stay at home whenever possible. Now here's what this doesn't mean. It doesn't mean don't go outside. We all should be outside enjoying the springtime. I'm seeing the flowers come up now, and I think it's going to be beautiful. But when you're outside and you're doing work in your yard, as you can probably hear right now, they're doing work in the yard right outside the hospital. When you're doing that, just stay in your own yard, stay away from folks, stick with your own family, because that's going to be the best thing that we can do right now. So before I go, I would like to share a brief story about how things are working with us. And we have 1,300 people that are part of Hancock Health, plus another 400 volunteers and about 150 physicians in practice here all the time. And they have been so supportive. And I will tell you that we have something called the Associate Crisis Fund. So when we have a particular employee that's in a time, especially of financial crisis, we all kind of reach together. So we put the word out yesterday into the community and said, if you'd like to help, because we get a lot of people calling us and saying, what can we do? We said, if you'd like to help, maybe you could donate to our crisis fund. And I will tell you, in a matter of hours, we had almost $4,000 that was donated to our crisis fund. That is exactly the kind of support that we see in this community. It's an amazing, amazing place to be. So let me remind you as I end that if you are experiencing a fever or cough or shortness of breath, please call the coronavirus hotline. It's 317-325-2683 or 325-COVD. That's 2683. Or you can contact us via email at nurse@hancockregional.org. Again, it's nurse@hancockregional.org. And make sure that you go on our website. There's all kinds of tools and education that we have for you. And I would go there. It's hancockregional.org/coronavirus. All kinds of things. If you go to our website, it's going to take you there right away. And as you go through the course of the next week, we're going to be back here with you again next Friday, I think, and often do updates. Just please keep in mind that this is a different kind of time that we're all living through, something that we may not ever go through again. Certainly, it's the first of its kind in my lifetime. And the key for us is social distancing. Again, it's physical distancing. Keep in touch with your loved ones, but keep physical distancing as the key. If we work diligently and we do these things, I am positive that we're going to come out through this thing in a far better place on the other side. And we will have learned a lot of lessons in the meantime. So we'll be live again next Friday morning, 9:45. So from now until then, stay healthy. We're going to save lives together. Thanks for watching.